We apply Botox for sweat treatment, especially in the underarm area, palms and soles of the feet. Patients we treat for hyperhidrosis are slightly more fortunate than those who present solely for cosmetic reasons. Because while the duration of effect for Botox applied for aesthetic purposes is on average 6 months for sweat treatment, this duration extends to 9 months or even up to 1 year. It can extend. Here, our approaches must be slightly different depending on the area where we will apply the treatment. And therefore, I will discuss all three areas separately. For the axillary region, we can proceed using only local anesthetic creams applied directly to the underarm area to provide numbing. We can do this treatment easily. Here we first delineate the areas of most profuse sweating into squares measuring roughly 2 centimeters by 2 centimeters, after determining them as rectangles, then for each area for each square. We inject the necessary dose into the skin, into the region where the sweat glands are located. We observe that the effect is fully established in about 1 week to 10 days, and especially 9 months. We will witness this effect continuing for even sometimes 1 year. Therefore, I want you to know that this is not a painful procedure. We will see the effect immediately. However, we must perform the application on the palms of the hands and the soles of the feet a bit differently. Since the palms and soles are more sensitive, sometimes we use a nerve block or even operating room sedation, meaning we put the patient into a state of partial unconsciousness to perform it effectively. Especially in the palm area, given the close proximity of the muscles controlling hand movements and the very thin nature of the skin, we genuinely must organize the procedure in a manner that the physician can also perform it comfortably. Since we do not want this medication to penetrate or have an effect towards the subcutaneous layer or the muscles. As our sole objective is to halt the activity of the sweat glands located within the skin layers. A little more, we are obliged to proceed using nerve blocks or sedation, particularly for the palms and the soles of the feet, though I highly recommend this approach. When we carry out the procedure here, I want you to be aware that we utilize extremely fine needle tips because of the precision required for this procedure, and as I just stated, the effect will last on average a minimum of 9 months. And for a whole summer, meaning the troublesome period of spring, summer, and even early fall, if done now, you would be completely free from sweating problems. You will be rid of your sweating issues. Of course, should we stop sweating 100% here? I do not think it is logical to stop it 100%. Reducing the part that socially bothers us is more than enough. After all, sweating is a physiological event. It's part of the body's defense mechanisms, so this is my general recommendation to patients. Reducing perspiration by approximately 90% will entirely resolve their social difficulties, and we will not have disrupted normal physiology. And anyway, they will be free from the problems and discomfort they have in spring, summer, and fall.